YouTube, Nurse Leslie here, the Beauty on Duty. Today's video is the start of my new 3-part series called What's in the Bag. So this series will consist of me talking about my lecture bag, me talking about my lab bag, and me talking about my clinical bag. And today I'm going to start off with my clinical bag, the things that I need at clinical to ensure that I have a successful, smooth sailing day. My first thing that I want to tell you guys about is my handy dandy Nurses Clinical Pocket Guide. They have it for LPNs as well as RNs, and they have them for medical assistants too. They're about $25 to $30 depending on where you buy it. I actually got this one at Barnes & Noble, and I believe it was $25. Really awesome book, if you can see that. So the first section is basic care, like doing sterile dressing changes, ostomy care, NG tubes, a lot of the really cool things that we learned in the first semester. The next section is about assessment. The next one is lifespan, then there's MedSurg, and then meds and IV fluids, labs and EKGs, very helpful. We're not required at this point to know the lab values, but you know this is definitely something you're going to need to know in the future. So it's really nice to have a head start and to be able to look at this type of stuff and start to learn it before it's even required. That way I'll have a little bit of an easier time later on when it is required and I'll already know it. So pretty cool. The next section, patient education. Oh, this is good. Foods to avoid with certain drugs and herbs. For instance, digoxin. Avoid or moderate high fiber foods and meals. And I believe that's because the fiber may absorb the medication and excrete it instead of letting it work inside the body. Not sure about that. I'll check on that and let you guys know. The next session is tools. This is really cool also. It has a section where you can learn about cultural diversity in healthcare so that you're able to give that great level of care and be compassionate and empathetic to people's culture and be respectful. For instance, there's a section on Russian heritage, how to communicate with the client, how they normally have their healthcare, their normal healthcare practices, diet and nutrition, pain management, death and dying, and taboos and disrespect. Really good things to know when you're dealing with or caring for a patient with who's from a different cultural background. Really awesome. Today I actually picked up another little handy dandy Nurses Pocket Guide, and it's on MedSurg. Next semester, which is starting in about 3 or 4 weeks, we're going to be doing MedSurg in a hospital setting. We're actually in long-term care right now, but next semester we'll be in a hospital doing MedSurg, and I think this will be really, really helpful. You can see that? You can check that out also. This one was actually $28, and it's a little bit thicker. Haven't really started reading it yet. Like I said, I just got it today. The next thing that I have to have at clinicals is my drug guide for nurses. Awesome book. When we're doing med passes, we have to be able to discern what to look out for. You know, the contraindications, the adverse reactions, things like that. We need to know what the drug is, why we're giving it, what it's supposed to do. And this book is really helpful because you're never going to be able to know what every medication out there in the world is gonna be. So it's good to have something there that you can look it up in. The next thing, hand sanitizer. Okay, it's just really great to have because there are lots of germs in the healthcare facility. You need a watch. I have a tattoo here on my wrist, and I use this one to cover my tattoo. Fits perfectly. It has the second timer, so it's really good to have a watch because you need to be able to count respirations. You need to be able to measure the pulses. So have yourself a watch. Very important. Stethoscope. This one was actually a gift, and it works really well. It has the double bell. You just switch it, and you'll stick it down in your ears and tap it to see which side it's on. Works really well. I love this stethoscope. The brand is called Lane. which I never heard of before. A lot of people like Littman, but this one works really well for me, and it was free because it was a gift. Okay. The next thing is my little blood pressure bag, which I keep other goodies inside. Ink pen. In fact, that's my spare ink pen. I have two. One looks like a little syringe with blood in it, really cute. You know, people always want to borrow your pens, and sometimes they don't come back, so it's good to have a couple. I have my bandage scissors, just in case I need to cut off some bandages or cut somebody out of their clothes. I have my bandage scissors. Then I have some hemostats, really good to have. You can use them for picking up gloves out of the box, use them for lots of different things. Then of course I have my manual blood pressure cuff, which I'm not going to take out because it's difficult to put back in. I have alcohol swabs. You definitely want to wipe down your stethoscope before you put it on a patient and after you put it on a patient, reducing the chain of infection. Okay. I have two what do you call these? Pen lights. Okay, for checking the pupillary reflex, looking inside the ears, nose, and mouth. Really great to have two because, like I said, people sometimes borrow them, and just in case it doesn't come back, I have a spare, or in case I lose it, you know. The next thing is my clinical portfolio. I got a little artsy with that. All right, inside I have my nursing procedures guides for doing things like a 12-lead EKG, dry sterile dressing change, applying a sling, all the things that we learned in the first semester. I have a guide for it, just in case when I'm at clinical, I get called on to do something that I don't know how to do, I can look it up. Okay, next, nursing process care plan packet. We just did our first nursing care plan, and that was really interesting. It was very time consuming, very tedious. Lots of people hate care plans, but it really did help me to understand the disease process of my patient, helped me to get to know a lot more about her. So it was pretty cool. It wasn't the worst thing in the world. I have a copy of her MAR here, and of course all her personal and health information is blocked out for you know, security reasons. We don't want to disclose anybody's personal information. And it has all of her diagnoses, it has all of her medications, what time. So that was really, really helpful for me, especially when doing my care plan. Also in my clinical portfolio, I have my shop records, I have my physical papers, all the things that if need be, people can look and say, okay, she's healthy, she can be here. If you don't have this, they don't know. You know, so we have to keep this on us so that they know that we've gone through the proper measures to ensure that we should actually be there and caring for people. Like, of course, background check. You don't want maniacs, you know, treating your patients. So we have to keep that on us so that people know that we're capable and competent. So that wraps it up. I will leave information at the bottom of who these books are by, where you can pick them up, the price, and so forth. Really great books, you guys. Check them out if you don't already have them. And I hope you enjoyed this video. Thanks so much for watching. And don't forget to subscribe and rate and leave comments. Thanks so much, and I'll see you on the next video. Bye.